Hello, class. My name is Sachin Singh, and for the discussion this week, I'll be presenting a case about a patient that I saw in the clinic on the 6th, which was Friday. I evaluated a 32-year-old Hispanic gentleman, initials of A and G. This gentleman, he came in with complaint of right scrotal pain. His chief complaint was testicular pain. I'm sorry. HPI. This pain started on Tuesday, which was the 3rd. So he's been having this pain for about 3 days. He described the pain as a like a waxing waning type of pain. He described it as like a throbbing to pulsating type pain, which started on the 3rd. He did not try any medications to help with this pain, and the pain was a gradual onset, which got worse with time. He was unable to pinpoint any alleviating factors or even aggravating factors for his testicular pain. On the review of systems, he denied any trauma, any injury to his scrotum. He denied any nausea or vomiting. He denied any fever or chills. No complaints of hematuria, no CVA tenderness, no discharge from his urethra. And he reported having normal bowel movements. This gentleman, social history includes he denied using any street drugs, no alcohol use. He smokes about 10 cigarettes a day, has been smoking for the past 5 years. He has one sexual partner, which he has been with her for about 2.5 years now. Um, and he stated that he has been faithful to her with no sexual intercourse with anyone else. He could not, unfortunately, say the same for his girlfriend that has been seeing. He is a heterosexual gentleman. He denies any medical problems, no surgical history. He has never been hospitalized. His parents are well. His sibling, he has one brother with no known medical problems at all. This gentleman, he does not take any medications, prescribed or over-the-counter medications. Um, on physical exam, when I evaluated this patient, his abdomen was non-tender. He had positive bowel sounds on all four quadrants. He was non-tender over the suprapubic area. When I evaluated the scrotum, as he was standing up, the scrotum was in a horizontal plane. I mean, it wasn't a high-riding scrotum at all, which usually you could see that in testicular torsion. On exam also, I did not see any obvious discharge from the urethra. His scrotum did not feel swollen to me, but it was definitely tender on the right epididymis, which is the cord that comes from the testicle, and it sends up the spermatic cord. But he was definitely tender on palpation. Um, he had a positive cremasteric reflex, which um, is a reflex that's usually absent in testicular torsion, but it's positive finding in a epididymitis. He also had a positive Fern sign, which he voiced that he felt better when I lifted the scrotum. His pain was still there, but it got better when I did that, which is a positive Fern sign. So my differential included initially was epididymitis because he was tender on palpation over that anatomical structure. My second differential diagnosis is testicular torsion, which is a true medical emergency because of a high risk of testicular infarction if not treated. And my third was testicular cancer. With most likely diagnosis of epididymitis in this gentleman. I presented a case to my preceptor. Again, on my history and physical, this gentleman is sexually active. He does not use any kind of protection like condom, he's at a high risk for sexually transmitted diseases, even though he did say that he's been faithful to his current girlfriend, which has been with her for about 2.5 years. Girlfriend is totally asymptomatic. So my plan was we did a urine dip at the clinic, which was positive only for leukocytes, no nitrates, otherwise unremarkable. And then we did send the culture for chlamydia and gonorrhea, and also the urine culture. I with the diagnosis of epididymitis, likely of sexually transmitted disease in this gentleman. We offered him a treatment for Rocephin, according to the American Academy of Family Physicians, McConaughey and Penchel 2016, and IRE 2019, which I got that article from UpToDate, and also American Academy of Family Physicians. And I'm offered him a one-time dose of zithromycin, 1,000 milligrams PO, which he did take both of the treatment at that time. And we're expecting him to follow up here next week in about 7 days, also to discuss results about his urine culture, chlamydia, gonorrhea, and just to see how he's feeling. Um, this gentleman, he was kind of concerned, but most likely it was epididymitis, most likely contributed by sexually transmitted diseases. Hopefully, I'll be able to update you guys more on this patient when I see him again. I would love to hear feedback from my classmates on this case. Thank you so much. Have a good day.